There were nurses that would literally go to clubs and they would go and take their scrubs off, put on a dress, go dance for 45 minutes, run back to the hospital, and get back to caring for patients. Total insanity.
Yeah. Unreal. I did not know where the story was going. That is absolutely wild.
My friends, let us consider that acuity is the refined clarity of thought and perception which enables one to discern subtle truths.
Hi, everyone. Welcome to another week of the Acuity podcast. I'm Dr. Lavranos, the CEO and Chief Litigator at Acuity Medical Law. And with me, importantly, is my co-host, Amy Hamm, who's our communications manager. Some people gave me some grief about introducing her as a guest every time. She is the co-host. You guys are right. That is the proper nomenclature and title for her. The difference is that soon we will be releasing another series of episodes that'll come also once a week. And it will be just me giving a small talk on a medical matter or legal matter, the intersection thereof. And so, yes, Amy is the co-host of the Acuity Politics and Culture, but sometimes it just makes me feel as though Amy is joining special part of the presentation. So nice to see you, Amy. How are you?
Thank you. I'm great. Thank you for having me. I'm not offended by being referred to as a guest either, but I will accept either title. That's sort of my thing is the whole labeling things, titles. I don't really care about that stuff. I'm not easily offended, so it's all good.
Yes, but it's kind of nice to see the engagement from the viewers, and we are very responsive to the feedback. There was a really funny comment the last recording that we had. Somebody had observed at the 3 minutes and 16-second mark that I had said that I had just come back from taking a shift. They did not hear me coming back from taking a shift. They heard something else. They were like, "But you guys are so serious. Why is he disclosing all these like personal things about his habits?" I was like, "Wait, what?"
I saw that comment too, and I cracked up. And you know what's funny is when I announce what our topic is today, sort of one of the things we'll get into is doctors and nurses. Does anything gross them out? And so we can put this into context. But
yeah. Did you have a good week? Anything on the personal side that you wanted to talk about?
It was a busy week. I've just kind of been battling some sort of weird viral illness and hacking up and coughing a lot. So, sometimes your kids get really sick and you don't, and then other times it's the opposite. So my kids just were barely sick, and then it hit me like a freight truck. So it's almost over. I'm feeling pretty good though.
A lot of it going around. I think I was saying this to you the other day, right? Like a lot of sick people in the department. My family went through it. My kids are sick too. So I'm glad that you sound like you're doing much better and you look like you're doing just fine. So that's good. I'm glad to hear that you're on the mend. I want to talk about the elephant in the room. Currently, I'm sporting a mustache. Mustache is not my thing. I have this mustache because it was my older daughter's birthday yesterday, and she's really into Mario. And she asked me to let my mustache go, kind of like Mario or Luigi, as she likes to play as Princess Peach. Hence why my wife doesn't hate it. So I decided I would keep it for the episode rather than try to race around and clear it up. It's all right. It's tolerable, but don't anybody get used to it. It's not sticking around.
That is really adorable. And I have to say, you are, you've talked before about your daughter. She does a princess play. I've noticed in pictures, she's wearing princess dresses a lot. She seems very immersed in this world. It seems like a really, a hyper focused interest for her. Maybe she's going to become an artist or a writer or something because she seems so creative just from what I'm seeing.
She is,
I love it.
Remarkably creative, very imaginative. I love it. We were doing a little art and craft upstairs earlier today, and we lacked the color, the pigment to do somebody's skin, and then she wanted to sort of create King Triton from The Little Mermaid. And I was like, well, we don't have a lot of white for his beard. She's like, it's okay, we'll just use different colors. And I was like, why not? I guess we could give him a blue beard or a yellow beard. We don't have. So she is, she's very well immersed in that. She's got a fantastic imagination. I love that.
Oh, that's beautiful. You have to foster that in your kids too, and obviously you will. But that's cute. I hate this notion, the idea that kids are blank slates, because it's so not true. You see,
No, it's not
right right from birth, you can see personalities peeking out. And yeah,
It's hard, it's something that you do want to foster, to your point, but it's not always easy because children, like one of the things that happens as we grow is our ability to think laterally gets weaker.
okay. So let's get into the topic of this week. It's going to be a bit of a different sort of episode. I think it's going to be really funny. And hey, maybe we'll even hate each other at the end of it. We'll see.
A little bit of friction is good. It's good.
Okay, so this week, Dr. Lavranos and I were putting aside world politics and Canadian politics in favor of healthcare politics. So Dr. Lavranos is obviously a doctor, while I'm a registered nurse. And aside from having healthcare in common, we each practice additional and very different professional roles alongside medicine and nursing. So Dr. Lavranos, Aris, is also a lawyer. I'm a journalist / columnist. And then, of course, I work at Acuity Medical Law. But we're going to put these other hats to the side and sort of confront each other with the very worst stereotypes about doctors and nurses. So we've probably, all of us in the audience, heard or encountered these stereotypes at some point in time. And just to be clear, both Dr. Lavranos and I, we have the utmost respect for both medicine and nursing. But you also have to be able to really laugh at yourself sometimes. And then, maybe we'll both pray together that butthurt woke people are not going to just look at this and try to weaponize this conversation to file complaints to our regulators. Because we're just having fun, okay? We're just having fun here.
They're stereotypes for a reason. They don't apply all across the board. They're just kind of funny tropes in the cultural zeitgeist. And so we're going to touch on some of our favorites and comment on them in our experiences. So where do you want to start?
Exactly. So I think what we're going to do, we'll go back and forth. I'll read a doctor stereotype. You can kind of confirm or deny based on your experiences, your observations, and then you can do the same about nurses. And I think we should also probably assign a score. There's this thing in healthcare, and if you've ever worked in healthcare or been a patient, you'll be familiar with it's called a pain scale. And they'll be like, rate your pain from 1 to 10, 1 being like very mild, 10 being the worst pain you've ever experienced. But we're going to add a 0. So 0 would be like not true at all. And then 10 would be completely accurate. So let's do it. Should we do doctor stereotype first or nurse stereotype first?
Let's do a doctor one first, and then we'll go from there. I got the list up here as well.
All right. And so, by the way, some of these, I made a list, and some of them are based on really obvious things that we've encountered. I also asked Grok, what are sort of the stereotypes? There was a lot of crossover. So this is where this is coming from. So, okay, doctors, number 1. They might be considered separate, but I'm going to put them together for the purpose of time. So here we go. Narcissism. Elitism, and the God complex. Do doctors suffer from these conditions?
Stereotypically, I would say yes. I would say that they are more common in certain specialties than in others. But I think that the population has been exposed to this, and it's based largely on reality. I think that a lot of physicians, they walk into different rooms, they go to different parties, they get introduced, and people start asking them, oh, I wonder what your life is like. Oh, I wonder what you see. And so like a certain narcissism and elitism is kind of baked in, and it's kind of fostered by those around them. But, you have to have been rather successful to get into the practice of medicine, especially in Canada. And so it's a natural extension of the successes that you have that breeds to that. From a God complex point of view, that's like the ultimate level of the pathology, right? That's the far end. And it's a strange thing because a lot of people see that in physicians. But most of the physicians I know are not really like that. We consider a lot of things that we do a lot more mundane, right? There's got to be something not working properly in a psyche to think that, that gives you the chance to develop a God complex. My wife watches The Pit. A lot of people like The Pit these days, very popular show. And she thinks to herself, like, man, I can't believe my husband goes there and he puts tubes in people's, he puts lines in people's, and he knows all the right questions to ask, and he knows all the drugs and et cetera, et cetera. And to me, I'm just like, yeah, but I do it all the time. It's like a carpenter knowing what screwdriver to use, or like why you use this nail, not the other. It's like totally mundane. It doesn't feel like it's a particularly special or exceptional set of skills or knowledges. Yeah, okay, it helps someone who's in desperate need in that moment, but it's not like I'm MacGyver and just came up with something on the fly because I'm so creative and analytical. It's like, okay, well, these are the algorithms that I use, and these are the drugs that we use, and I just use them. So I would give that a score of 6 out of 10.
Okay. That's a fair point. You know what I would say on the flip side, and what I've noticed, I think I might agree with your score. I've noticed, and I had at one point someone, he wasn't necessarily my superior. We were sort of in the same level of management in healthcare. But this is a man, and he was also a nurse and also in management. And oftentimes patients would mistake him for being a physician. Just walking into a room, they think, oh, and they would say doctor and use his name. And it's part of your professional role is that you don't misrepresent yourself. I'm sure
Totally.
it's the same for physicians as it is for nurses. And for me, I've had that happen on occasion. And when it happens to me, I think it's because I'm a manager, so I didn't always wear scrubs, and I would often have a clipboard, and I'd be carrying like a laptop or a phone. So I think it was easy for people to be like, oh, you're a doctor, right? And I'd be like, no, I'm a nurse. But this other colleague of mine would just not respond and not correct the patients. It was like, how you so
Not
badly. No,
Yeah.
it's so inappropriate. It's like you so badly are you want to be a doctor, clearly, because you you won't even correct patients about what your role is. Very embarrassing.
Yeah, not cool. And also, it drives up that same sensation in the population, right? It's like, oh, here's somebody of importance, must be a physician, right? Like no, actually, I have a different role here, but it's also important. So yeah,
Yeah.
nobody does anything to really dispel this myth, I guess, is part of the problem.
Yeah.
Are you ready for yours?
It's very ready. Let's hear it.
Nurses are not smart enough to be doctors.
Okay, this is a good one. And I will offend many nurses when I answer to this question. But here's what I have to say about this, and I'm being completely honest. I think that if you were to look at any physician you would ever meet, every single one of them, if they wanted to, they could be a nurse. But if you were to look at every nurse that you were to meet, not all of them, maybe half of them could be physicians. So it's not that nurses are not smart enough to be physicians as a whole, but I think for some people would be excluded from the role of being a physician, because I do think that they're very, very different jobs. And that's what they are ultimately, is their jobs. And I don't think that every nurse has the capacity to succeed as a physician, whereas I do think that every doctor would have the capacity to succeed as a nurse. So if I had to rate this on our scale, I would maybe give it a 5.
Yeah, I think that's probably pretty reasonable. I think part of it is that, if we're thinking about that either from an individual's capacity in general, yeah, I think you're totally correct. But then, you find a senior resident in the Emerge or a recent staff in the Emerge, and you compare that to a veteran nurse who's been there for 10 or 12 or 15 years, now we're talking about really apples and oranges, because that 15-year senior nurse, charge nurse in the emergency department, has a tremendous clinical acumen. And she may not have, I say she because almost all nurses are females, but obviously could be a dude, which we will touch on in a minute.
Yeah.
But obviously she has a tremendous clinical acumen, and she may not have all the book knowledge that's necessary. She may not have the expanded differential. She may not have had the education in pharmacology and so on, like those things that really separate the two professions. But the risk with this is saying that nurses are not smart enough to be physicians, therefore their analysis is not as good as a physician's analysis, and that is totally false. right? So
Yeah.
depending on the nurse, depending on the physician, how much time you spent with the patient, questions that you've asked, how much experience
Yeah.
you have in a clinical world, and then suddenly it goes from a 5 to like a 2 out of 10, right?
Exactly. And part of that, I think, relies upon having a good relationship between doctors and nurses so that doctors can know who the nurses are, how trustworthy they are, what sort the acumen that they've developed over the years, and they can sort of see that enacted in real time and know when they can go to a nurse to sort of gather clinical information that would be really useful for them. And when that doesn't happen, I think, is when you have a healthcare culture that sort of pits doctors and nurses against each other. And I do think that's common, and that's really unfortunate as well.
Yeah, you're right. I should say, just from a legal side, um, several of my cases against physicians, the nurses actually astutely identified what we allege was the negligence. And so a lot of the time, the nurses seem to be more correct than the doctors when it comes to the medical legal side of things. I mean, like, don't get me wrong, there are
Interesting.
also nurses who are at fault, but there are occasions when they're like, hey, you know what, maybe we should do some imaging, or hey, you know what, I'm really worried about this person, or hey, they can't really walk all that well. And then they're like, a discharge order, discharge, send them home. And you're like, uh-oh. And then suddenly you got caught.
Yeah, and then you have to wonder about, what sort of systemic issues are causing this versus individuals' ability to perform their job versus burnout, the system being overburdened. There's so many different factors to look at when you consider how you arrive at truth and fault in these sort of situations, right?
Totally.
Okay. This next doctor one is very funny. And I love it because
Also
I
quite
also
true.
love yeah, oh yeah, I love short kings. So I gotta say the next stereotype is like doctors are taller.
Um, so I'm 6 foot tall. I don't think of myself as being particularly tall, but I'm 6 foot tall. And I've never really felt short in a room before until my med school class. In med school, all my friends except two were way taller than me. Like, we're talking 6'3", 6'4", 6'5", 6'6". We're talking very tall class. We had a professional hockey player on the team. He was 6'7". On the in my class, he was 6'7". I have a friend of mine who's now an anesthesiologist. He's 6'7". We called him Hightower.
Oh my
They were
God.
very tall, and there's generally speaking, there is a mechanism to suggest that this is more than just correlation, right? And the reason for it is because interviews are a big role in getting accepted to medical school, and people who are naturally taller, the shorter person who has to look up to them when they speak gives them the sense of inferiority. And so people who are taller are granted a greater degree of confidence, a greater degree of certainty. And so, yeah, on average, doctors are taller than other professions. And it's really funny. Even in my emerge, like, most of my friends are there so tall. I don't understand really why it's like that.
That's wild. I'm trying to think, like, have I noticed that? And I think so. When I try to look individually, I think the short king doctors might be few and far between. So you might be right. And it's very funny that we use height as a proxy for competence. I know that happens in the corporate world a lot too. And that's sort of, I've noticed, I follow these accounts on social media where they do limb lengthening surgery. And so these doctors do this. And part of the way that they market it is that they tell men you will be more professionally successful if you're taller, and it's known that this is something that will improve your life and your success.
Totally
Very
crazy.
bizarre.
It's like this
Yeah.
whole look maxing thing. You ever see these guys like Clavicular, who's out there and he like takes a rock and he like
Oh
beats his
my
face so
god.
that his chin gets stronger? It's like, these are just crazy things to do
Yeah.
to try and get a little bit of an edge, you know?
I'm new to the clavicular world. I saw a couple days ago that this he overdosed on a live stream and went to hospital. So I hope this guy, he's young too. I think he's like 22 or something. My god, I hope he's doing okay and I hope he sees the light. Like, what he's doing, I think, is completely ridiculous.
Yeah, I'm
Poor
not
guy.
involved in this subculture space at all, and it's crazy that given that neither you nor I are sort of invested in that world, we both know who this person is. What an
Yeah.
indictment of our culture at large, right? Like that we even know who Clavicular is, and we know about his habits and his consequences
Yeah.
is just insane,
We did not consent to know about clavicular, and
right?
here we are.
Okay, number two for you. Nurses are crazy party animals.
All right. Well, you know what? I think that there are two different cultures in nursing, and some nurses are sort of, especially in Canada, there's so many like really sweet Filipino nurses, and they just embody what you would think of as a classical nurse, like a caring, wonderful motherly type figure. They have a big family, they have their priorities, they work so hard. And then the flip side of that is these nurses who are like younger and would sort of fit this party girl stereotype. I think it's very real. And one example that I would give is when I was doing so I went to the University of British Columbia nursing school, and you have to do sort of like two sort of preceptorships at the end of your program, which is where you spend, I think, 6 weeks for each one working every day. You shadow a nurse, you do their schedule. It's usually like 4 12-hour shifts a week, 4 on, 4 off. And so I was doing this in acute medicine at St. Paul's Hospital, which is one of the biggest hospitals in Vancouver. And one of these nurses that would be on mostly the same schedule with my preceptor, I kid you not, it's like we're in the middle of giving like cancer medications, just receiving admissions from the ER at all hours of the night, and it's nonstop. It's complete and utter chaos. Codes are going on, absolutely insane. And then you go on your break, and we had this system worked out where the nurses on the unit would have the little like living room for patient families during the day, and they would try to go in there. They turn all the lights off, they have blankets, they sit in chairs, they try to close their eyes and rest for an hour at a time. There were nurses that would literally forego that and go down, because we're right downtown Vancouver. They would go to clubs, and they would go and take their scrubs off, put on a dress, go dance for 45 minutes, run back to the hospital, and get back to caring for patients. Total
Unreal.
insanity.
Unreal.
Yeah.
I did not know where the story was going. That is absolutely
Yeah.
wild. I've met more than my share of party girl nurses. Like lots of them on rotations around Canada during clerkship, residency, and so on. There's lots of them who like that. The only thing I'll say that kind of is the causative component there is that generally speaking, you can graduate from a nurse at a relatively young age, and so you still have your nightlife days going on concomitantly. So that's one. The second thing is when you are already doing day, night, you're off for
Yeah.
four. Like staying up late and partying is part of the natural cycle anyway. And
Yeah.
so, you can imagine that you do a Tuesday, Wednesday day, Thursday, Friday night. Suddenly, Saturday night, Sunday night is just spilling over, like into the regular habit. And so, I think that there's
Yeah.
something to be said about what the schedule kind of engenders in someone to continue to their partying.
All week long. I know what I would spend those times lying awake thinking I'll close my eyes. I close my eyes and I would see like IV compatibility charts in my head. I'm like, oh my God, did I get fluids that are incompatible? And then I'm like, get my phone. I'm like, no, no, oh no, no, it's okay. I didn't kill anyone. Just
Yeah,
that was what
two
I was
thirty in the morning
doing.
trying to get some sleep. Yeah,
Yeah.
yeah. So I
Okay,
would give that. What do
next.
you think? That's like a 4 out of 10, maybe. Like a
Yeah, that it's a subculture in nursing that it definitely exists. But there are also some nurses. I think it depends on the type of nurse you are. That is definitely a nursing subculture, 100%. So I might go with five again. In some cases, absolutely. But then there are some nurses who have nothing to do with that, if that makes sense.
Yeah, totally. It's a little bimodal, right? Like in this
Yeah.
population, they love the party, and in this population, they don't love the party. So yeah, I see that.
Yeah. Okay, doctors, driven by money or greed.
Um, it's tough because we're often asked in our interviews trying to get into medical school, well, why do you want to become a doctor? and you kind of script beforehand, well, I really love helping people. Well, I've seen lots of sick people in my life, and being there for them means a lot, etc., etc. But at the end of the day, it's a high-paying profession. So it plays a role for physicians, but it plays a role for everyone. Everyone chooses the job that they can get the most bang for the buck that they have, right? So
Yeah.
yes, but I don't know. I don't think it's anything more than that, right? Like a lot
Yeah.
of doctors take sort of like weaker paths in medicine in terms of income. So like ophthalmologists are very, very well paid, and not everybody's going to med school to be an ophthalmologist, right? A lot of people want to go into pediatrics, which is historically one of the lower end of the pay scale. And we know this because RBC actually publishes this data, like what the average person does. And so we have, I'm very familiar with that data. And also, I mean, like some people enjoy, one of my very good friends in the emergency department, he only works like a point 0.4. He could be working a lot more. We've solicited him to work a lot more when we're hurting for shifts, and he likes his time off. So it's not
Yeah.
it's not really about that. I would only give that like a 2 out of 10.
Okay. I think that's fair. I've noticed the same thing, and they do the same sort of questions for any profession, and it's basically, I liken this to, you go into a job interview and say it was for nursing, and they're like, tell me all the ways that you are literally Florence Nightingale. And if you are not literally Florence Nightingale, then get the fuck out of here. And it's like, come on, are we not everybody is that saintly. And that
Right.
can be said of any profession. Like, people make pragmatic, rational choices about what they do and what their aptitudes are. And you don't have to be an absolute, complete saint to want to do something. Obviously, people do it because they care about patients and they want to do good in the world. And they also recognize that I can support a family, I can have a good living, I can have a good life at the same time. And I think it does a disservice to sort of pretend that doctors should only be interested in being doctors because they're saints. Like, that's kind of stupid.
Agreed. Often when I'm coaching people who are applying to med school, and I'll ask them this question, you know, whatever their answer is, if it does not include some kind of financial component, I'm like, oh, well, why did you not choose social work? Oh, well, why did you not choose nursing? It's a shorter road, and
Yeah.
it'll help you get right to the bedside, and you provide a lot more close care. And then you see them kind of stuttering. It's like, well, you can just say, like, my grades are good enough. I feel like I would succeed here. The income is greater. The lifestyle is better. Like you can go and say the
Yeah.
material, pragmatic components that contribute to why you're making the decision. Doesn't mean that you're necessarily greedy or that it's even the primary motivating force, right? It's a supplementary
Yeah.
force.
Yeah, just be honest. Okay, so did you give a score for this one?
I would say 2 out of 10. You?
Okay. I think that's fair.
Yeah.
I agree, especially in Canada. Doctors in Canada don't make nearly as much as American counterparts make.
Totally. Yeah, it's another good point. You could very easily have left, right? Like you're choosing to not follow the top dollar.
Yeah.
Okay, number 3 for you. All male nurses are gay.
Ooh. This was, I think at one point it was definitely true. When I
Yeah,
was in,
yeah, definitely.
am I going to get canceled for saying that? But no, it totally was true at some point. And I think now, and I would say one of the good things about our culture, I have issues with our culture sort of completely abandoning roles for male and female. It's good that we accept gender nonconformity. It's good that we are not homophobic and that we're open to the various ways that people just want to express themselves individually. All of that is great. And I think that is what has led to more men joining the nursing profession and not feeling as though it would emasculate them or that only gay men do this. And I think that's partly why it used to only be gay men that did nursing, because the idea of being like a caring person, a nurturing person used to be seen as something that only females do. And now the profession is open to pretty much anyone. And I would say it's still predominantly female. Part of my old job was looking at bringing student groups in and approving them for my unit. And it was still about 80% female. And of the men that would come in, at one point it was like, it was all gay dudes. And now it's mostly not. So that has
Yeah,
totally flipped on its head. It's just really
yeah.
not true anymore.
It is. I agree. It is no longer true. The department that I work at, we have a huge number of male nurses, and there was one who was openly gay, and he recently retired. And otherwise, the whole batch of the new young guys who are there, and I'm talking like, if we have 50 nurses, probably between 50 and 60 nurses, I mean, like 10 of them are male, maybe
Yeah.
more, and none of
Yeah.
them are gay. So it's really really changing. One of the things that I would say is that you know from a work life balance, especially for the level of training that you have to go through and the cost of training, actually the calculus is changing dramatically, right?
Yeah.
So do you want to finish with 120, 125,000, $130,000 worth of debt, and it's going to
Yeah.
take you a lot longer to pay it off, and interest rates are not as great, and so on and so on. So people are making the calculus to be like, hey, you know what? I like medicine, I like healthcare, I like job security, but
Yeah.
I don't need that long haul. I'm very happy and very comfortable with myself to do this. And I
Yeah.
totally applaud it. Like you said, yep, this is a great change in society.
I think
So
so.
I give it a
Yeah,
five.
there's
I give it a 5 out of 10.
yeah, it used to be it used to be a 10. It's not really
Yeah.
true anymore, but there we still have a lot of the gay ones that have yet to retire.
Yeah.
And I love, by the way, I love a lot of those gay nurses. They're so fun to work with. Just
Yeah.
absolutely a delight.
The guy I'm thinking of, he was definitely one of my closer friends. I really like that guy. Really like that
Yeah.
guy.
Okay, this is a big one for physicians, and it sort of gets into a lot of bigger societal issues, but this is the notion that doctors are paternalistic.
Um, I would say that that is largely false, but equally so, it was much more true, like a generation ago. So first, paternalism. Paternalism is a practice or a style of medicine where the doctor knows best. You need to follow their orders, kind of like a father figure. And there are many, many different types of models of the relationship between physicians and patients. There is the patient and friend, where the doctor is trying to emulate a friend, giving you advice and helping through a difficult time. There's the teacher, where the teacher comes in trying to educate you with a particular path in mind, but respecting your own opinions. There's the patient and the scientist, where they come in there as robotic as possible, presenting only evidence, and they try not to sway you one way or the other. So there's like a whole different series of paradigms of what the relationship can be like. Um, Older generations are much more paternalistic, and the tricky thing is that older generations of patients kind of seem to prefer that. And so
Yeah.
this is a bit of a moving target with what the population wants from their physicians. So it's not, like we today put paternalism in a very negative connotation, right? That this is actually
Yeah.
not appropriate and we shouldn't be like that and so on. But a lot of the time, patients will say, well, doc, what do you think? You tell me what to do here, right? Like they want to offload the burden of that responsibility and the decision making to somebody else. And when I was growing up, my physician was we had a very paternalistic relationship, and I liked that. I didn't disagree with that at all. I'm like, okay, well, the doctor knows best, and this is what I'm going to do. There was also a time where, like, the American Medical Association was even advocating for positions of like denial of informed consent. That informed consent was not an appropriate thing to seek because there is very good evidence that when you tell somebody the truth, and if the truth is dismal, their outcomes worsen. And so, in a sense, you have a responsibility to try and hide some of the harm so that patients have the best possible chance at improving their outcomes. So, if I'm like, oh, well, there's like a 50 or 60% chance that this will kill you in the next year, people get dour and despondent and hopeless. But if I say, no, I think everything's going to be just fine, they go off and they live their life their best and they exercise and they do everything. They're like, oh, that was a near miss, and their outcomes improve. So, in a sense, there is some rationale behind this method of relationship. But today, people have largely abandoned it. It's also advantageous medical legally to have a shared decision making with the patient to say, well, you know what, I presented all the facts, they made the decision, I talked to them, I documented it, these are the reasons why they made that decision, and I didn't push them
Yeah.
one way or the other, even if that is negative prognostically. So
Yeah.
people like it.
Yeah, that's funny. It's similar even with the idea of harm reduction, where there's this idea that you do a sort of care that's supposed to be more collaborative and you enable people to maybe do what they want to do versus what's best for them. And it's just sort of I don't think we necessarily always look at the bigger picture and the way that why are we doing what we're doing, and how does it actually affect people systemically. And I think paternalism is an idea of that. And it's something that I've noticed with the idea of paternalism, and even when I went and applied for nursing school, I can't tell you how many people said, so for me, I was like, I had already studied journalism and I wanted sort of a stable, secure job that I could do. And I was interested in healthcare and in science. And I thought, this is something I can do and also work as a journalist. And it made a lot of sense for me. And so many, especially women, were like, oh, it's like the nurses are better than the doctors. They know more than the doctors. And the doctors pretend that they know more than you, but it's not true. And you're actually smarter than them and blah. I'm like, why are you saying this to me? Because I'm not going into nursing as like a failed doctor. I'm going because I chose to do this. It's a different profession that I chose to do. And why are you acting as though it's very infantilizing of you to assume that I'm like a failed doctor and to tell me, oh, I'm better than a doctor. No, I don't think that's true. I actually think physicians have a more difficult job, more responsibility, vastly more responsibility, and vastly more knowledge than nurses have. And there's nothing wrong with that. It's just something different. And I think this all falls into sort of our culture's obsession with third wave feminism or liberal feminism. And they see sort of the paternalistic history of medicine, and they just lump that in with like the patriarchy, and doctors are mostly men and they're bad, and it drives me absolutely insane.
Yeah, I totally agree. Yeah, I totally agree. It doesn't have to be that way at all.
No. So I'm going to give the notion that medicine is paternalistic, I would say, like I don't know, I'll give it a 2.
Yeah, same. How about nurses eat their own and they're horrible bullies?
This one is deeply personal for me because I just off the bat, I'm giving this like a 12 out of 10. And
Okay.
Not only have I seen it enacted throughout my entire practice, and I think it also ties in with a lot of what I just talked about, where there are people who have sort of a thorn in their side about feeling lesser than, and they feel like they're in a hierarchy and they try to react against that. And oftentimes the people that they react against are their colleagues and fellow nurses, whether it's a student nurse or a nurse with less experience. They treat them really poorly. But, in my case, I had people try to cancel me for my political views that were only expressed outside of work. And it culminated in people making complaints to my nursing regulator and, more than 20 days of hearings. And the persons who testified against me included the director of the nursing school that I got an honors degree in nursing at, University of British Columbia. Basically going and testifying against me, calling me a horrible bigot years later. So absolutely 12 out of 10. Nurses, it's a huge problem in nursing culture. And I saw it working as in management and as an educator and as a nurse who went from starting with no experience and seeing how poorly your colleagues treat you when you're new.
The hierarchy thing happens, and there's lots of it, unfortunately. Yeah.
There is. And, you also have to acknowledge the fact that it's a female-dominated profession. And we know from a lot of people, Jordan Peterson has talked about this a lot, is that the way that
I was just going to say the same.
The way men solve disagreement, enact sort of aggression or violence is physically. They'll outright say, I'm mad about this. They might become violent if they can't solve a problem using their words. And female aggression is very different. It happens along the lines, but I don't want to say violence and talk about words, but I would say female aggression is like, it's reputational destruction. It's spreading rumors. It's behaving like this. And because we don't engage in physical violence as much, so we do these sorts of behaviors. And when you have female dominated professions, these behaviors become a real problem, and they are a very real problem in nursing.
Yeah, Unfortunately, I would give it more true than not. So I'd give it like a 6.5 out of 10 for sure.
Yeah. Yeah. Okay. Moving on from the sad. Oh, I'm gonna do like just some low hanging fruit. Not a very difficult one for you, but I also wonder like what the hell? Why can't doctors just write better? Doctors have terrible handwriting. Why?
It is totally true. It is horrendous, and I would say it's like almost ubiquitous. It's across the board. It's it's actually hard to find the instances that disprove this rule. Of all the charts I see, if I go through like both from the legal side and from the medical side, I'm going through hospital records all the time, and if I can read a chart easily, that was not a physician who wrote it. Like it's a near guarantee. It might be like a resident. It might be like a clerk. It might be a med student who wrote a note. It might be a physician assistant who wrote a note. But doctors have horrendous handwriting. Um, and, like I've noticed emergency physicians, because we see so many patients, right? Like we just see so many patients and we're writing the same series of, like 50 to 60 words on every chart all the time, past medical history and diabetes and hypertension and vital signs within normal limits and et cetera, et cetera. So we're always doing the same thing. And so it does get tiring writing the same thing over and over again. When I first started as staff in Nova Scotia, I actually generated, and I should do it again. I generated a stamp that had a physical exam and past medical history, and I could stamp it on a chart and then just check, 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 check. And
Perfect.
that made a big difference. It was also faster. But in general, it's just you're writing the same thing so many times repeatedly. For the vast majority of patients who are totally fine, you're not expecting them to come back, you're not expecting bounce backs. The chart is not as important as a complicated thing that you are trying to communicate for future readers. And so like you can imagine the 10th upper respiratory tract infection I've seen on shift is going to be very, very poorly written, let alone the 100th that I've seen that month, let alone the 1,000th that I've seen that year. You know what I mean? Like it's a lot. So our handwriting is generally speaking terrible. There are some subspecialties though who have different styles. And I remember I was on neurosurgery. I did a lot of neurosurgery. I thought at one point I was going to become a neurosurgeon. And neurosurgeons, their handwriting is like what we call micrographia. It's tiny. It's
Oh
tiny.
yeah.
The letters, the script was so small. And I remember thinking to myself, like, what is going on here? And I asked my staff, and she's like, yeah, we call it micrographia. And there's like we're pretty meticulous and we like to write real small and we like to be very careful and every millimeter counts in the brain. And so you can see this as a natural extension of our charting. So maybe it's also a component of the fact that emergency physicians are just big scope people, high level of risk, high level of uncertainty. The chart is horrendous and we moved on with our lives.
It's like expressionist painting or something.
Yeah, it's so
In
true.
your handwriting. Yeah.
Yeah.
And I'm partly why I'm so if I sound frustrated about it, the reason I am is I don't work in a hospital anymore, but I still every week I do some work for a GP friend at her clinic, looking through all of lab results and everything. So if her patients go to the hospital and then I see in what I'm looking through, I see like ED report, I'm like, oh God. And I know I'm going to open it and it's going to be like scribble, scribble, scribble. And I'm going to be looking at it like, what does that say? What happened? And you'll get that before you get other results too. So I'm like trying to interpret that and tell her, oh, I don't know if you have to follow up with your patient because I can't read this shit. So
it's so funny you say that because wearing the other hat in the legal world, when I'm decoding medical charts, I find it very easy to read medical charts. I find that the writing, mostly because I know the kinds of things that they would write, and so I can kind of read into it pretty fluently. But I've been in discoveries many times where I'm talking to another physician, and I'm like, oh, it seems to me like what you've written here says objective / vital signs within normal limits, normal S1 and S2, no extra heart sounds, no murmurs. And you'll see the other lawyer look up like, my God, man, how can you read that? I didn't know it said any of those things. Yeah, so you get pretty good about the reading component about it, and it's a form of code between us, I guess.
that's true. Sometimes, but I don't know. I still get frustrated by it. So do better is what I'm saying.
Yeah, I mean, I give it a 10. Like, this is the 10 on my list. It's totally true.
Yeah.
So, we should do better. Okay.
I'll give it a 10 as well.
Nurses are handmaidens to doctors. They do the dirty work of doctors. True or false?
I'm going with false on this one, and a lot of this
I'm glad
sort
to
of
hear you say
ties
that.
in.
I'm glad that
Yeah,
you say that because I think that it could be true, but I know that like me, my friends, my colleagues, we try that. That's not true. You know?
yeah. And there's definitely this attitude that people can have if they see themselves only as a member of a hierarchy, and they're always trying to challenge that hierarchy, and they might feel that way about what they do. But I don't think that's what it is at all. You talked, I think we both did, about the tremendous responsibility that physicians have to determine, like, number one, you guys diagnose and you prescribe a treatment, and nurses have to enact that treatment, or give, whether it's medications or do IVs or whatever else we have to do. And the amount of mental responsibility that entails is huge. And for a nurse to just turn around and be like, oh, well, I'm just your handmaid. And it's like, well, then what? Do you want to take on the vast responsibility of determining a diagnosis and opening yourself up to, like, what if you're wrong? What if you get things wrong? It's like you're having somebody tell you, this is what is going on and this is what you have to do. And that's your job. So just do your job. That's how I really
I think
feel
that
about
that is.
it.
I think that that is totally fair. Okay, I think that you're. I think that you're right. It is wrong to feel that way, given the nature of both jobs. Now that being said, there are certain orders that someone might write where it is kind of offloading a burden and something that the physician is trying to avoid doing. So, like, one of them that, and I admit I do this extremely often, and I am very sympathetic to the
Uh-oh.
nurses when I make this request. But if I write something like orthostatic vitals, like as if I
Oh,
can't go in
yeah.
there and do orthostatic vitals myself while I'm talking to the patient. Another one is, can we do a walk test? There is absolutely no reason why I can't go there and get a patient up out of the bed and see how they do when they walk to and from the washroom or around the nursing station or whatever. Part of it is, yeah, I don't really want to do it. The other part of it is that in that time,
Oh,
I could have
no.
seen another patient. I could have,
Yeah.
discharged someone, right? And so I very rarely stop on shift. And if I can offload the time burden to someone else, then that makes me feel a little bit better about, my efficiency.
Yeah.
I've asked the nurse many times, and I'd love to get your opinion. Are there orders that are given that you're like, oh, come on, man, we do not have to. Oh, come on, do we really have to do that? So is there a time when it does feel like you are being asked to be more of a handmaiden?
Well, I mean, maybe I'm coming at it from a different perspective because I've never really felt like that. I just thought, like you said, I think the physician's role is more in, you do an assessment, you do a diagnosis, and you determine the treatment. And I think that you should be spending most of your time doing that. And if you were to be doing orthostatic vitals, it's taking away from your expertise. And that would be a waste of your time. So
Oh,
I
you're a great
think.
nurse, Amy. You're a great nurse. You make me feel way better about my practice. That's wonderful. Yeah, you're a great teammate. Yeah, I'm glad I
That's
hired
and
you.
I mean that's honestly how I feel, and I think that the nurses who get up in arms about it are just being a little bit silly and thinking that they have more importance than they do in the system. It's like, this is what your role is. I think it would be like the care aides that get frustrated with nurses because they're like, why didn't you help me with the bed bath? And it's like, well, I don't think you recognize that I delegated this task to you so that I could do more nursing oriented tasks. And maybe it would be good to be there to do a bed sore assessment, and I can pop in and I can look at someone from head to toe. But it would be a better use of my time to be able to quickly do that assessment and then go out and do something else, and you as a
Right.
care aide should do that. So I think
That's
it's
fair.
always,
Good for
and it's
you.
like,
Yeah.
respect the person's profession. I think it comes down to that.
Yeah. Ah, that's so great. Thank you for saying that. And I do believe that you mean it, but thank you for saying that anyway.
I do mean it. Okay, is it my no? Wait, yeah, it's my
Yeah.
turn. Okay, this one, you're not a surgeon, but I think we've all heard this stereotype that surgeons are sociopaths.
Um, so, okay. So first, there's a difference between sociopaths and psychopaths. Okay. And it's going to be an important distinction because sociopaths break social norms. So it's the kind of person who you step into an elevator with them, and instead of them, looking at the buttons, looking at the lights, looking at the walls, they stare at you. Right? Like, that's a sociopath. It's not anything that's like particularly villainous, but it's like, well, that's a really uncomfortable thing. Like, why would you be doing that? Psychopaths are ones who basically lack a sense of empathy. They think of human beings as not sufficiently similar to themselves. They don't have the same value, and so on. So the reason I bring that up is because the rates of psychopathy in physicians is higher than in the general population. The general population is 1 to 2%. The rates in physicians is about 4 or 5%, which is similar to like high-end CEOs. And then in prison system, it's like 12 to 15%, which is what you would hope, because most psychopaths do something crazy and then they get arrested and they spend their lives in jail. So I would say that the skew of the 4% of psychopaths lean more towards surgery than they do in other disciplines of medicine. And the reason for that is because, like the physical work associated with it, the less time that you spend engaged in, like, family medicine has the therapeutic visit. You are talking to somebody, doing, emotional counseling and so on. Those are the kinds of things that a psychopath would not want to do. As far as sociopaths go, I would say it's pretty even across the board. I know a lot of really weird emerge docs. I know a lot of really weird family doctors, and I know a lot of really weird surgeons. People who are just like, like bathroom humor in the middle of the OR, or things that are just like not social norms. Like walking
Okay.
around barefoot. It's like, you don't have to be
That's
barefoot
so
here, brother.
weird.
Exactly. It's like not terrible, but you don't have to be doing that, right? Or picking their nose
Yeah.
overtly while they talk to you. It's like, what? That's really uncomfortable. So
What
I
the
think that's like,
hell?
I would say that that's kind of like across the board, kind of everyone in medicine could be that.
Okay. Okay. So
That's a
what
deep
would your score
psychological
be?
dive, huh?
It
That's a
is, yeah. The stereotype is, I don't know how you would assign that a score, because
yeah.
it's not
I'd put it
entirely
like
true, but
it's not entirely false. I'd like a 3 or a 4 out of 10.
okay.
It's a crazy thing, Amy, that this has come up on the list because my background before medicine was I did a degree in psychology and neuroscience, and I thought about those things and studied those things a lot. Hence why those numbers and is just like at the top of my mind. Yeah, but I've thought about it a lot, and you get pretty good at seeing that both in your patients, as I'm sure you have, especially in mental health. You're like, man, that's a weird
Yeah.
person, right? Like, breaking
Oh
all these
yeah.
social norms, and you get good at spotting these kinds of behaviors in people.
And I had back in, this was like before I think I was applying for nursing school and this happened, but I had to have a surgery for what happened to be a benign tumor removed. And I remember going into the surgery and they were like, oh, it's probably nothing. It's probably benign. But, well, we'll just send it to pathology just in case. And I had never had a surgery before. I was really nervous. And I remember going in on like the day of, and the surgeon pops into the room when you're in the gown. And she's like, how are you feeling? And I was sort of like, I'm so nervous. I'm so scared. And she was just like flat. She's like, why? You're going to be under general anesthetic.
Yeah,
I'm
yeah,
like, oh,
exactly.
okay.
It's so true.
Yeah.
It's so true, right? Yeah.
No empathy.
Okay. Number 6 for you, our semi last one is the nurse ratchet,
Yeah.
kind of cliche. Can they
I
be
think
pretty nasty, pretty offensive?
Yeah, I think this is the flip side of the sociopathic or psychopathic doctor thing. Clearly, there are people who have problems and they are violent or want to inflict harm upon people. Maybe it's and they're drawn to the profession as a way for themselves to enact that, and they hope that it would give them cover. And I think it's the same as people who either have like gone into the church and they're pedophiles, or into becoming a daycare worker and they're pedophiles, and they hope that a profession will give them cover. So I don't think that it's a stereotype that is widespread whatsoever. I think I've definitely over the years met a couple of people who have raised little tingly, like, what the hell, this person's a little bit freaky. Not that I've ever seen someone doing anything horrific, because of course if we had, we would report that. But I do think that there's something to the fact that, and we know just on human nature, that people who want to inflict harm and are bad people will be drawn to places where they get cover for doing that.
Totally. Yeah, yeah. There was that, like, I think it was in the UK, there was that nurse who killed like 80 people or 90 people and was doing it because they loved the thrill of trying to do a resuscitation on them. And yeah, I mean, like, So you're right. The profession gives you the opportunity, the nefarious opportunity to hurt others, and so you'll have
Yeah.
that gravitational pull for those kinds of people.
I think the scariest thing about these people is not the people themselves, but it is the fact that our healthcare systems and the people working around them enable them to continue because we're so afraid to sort of, and we've seen that like with the case you're talking about. There's a new Netflix documentary about a nurse that was working in a NICU, like a neonatal intensive care unit, and had various ways to bring medical crises upon these prematurely born babies, and was doing the same thing. And it takes so long for this internal investigation, which, and these hospitals, they tend to try to sort of protect their own, and the unions try to protect their own, so these people get away with inflicting harm for far longer than they should. And I think because people partly are afraid in the big healthcare system to call it out, or to just say this is what I'm seeing and I have this concern. And so that, I think, is the scary. It's not that, because I think it's so incredibly rare that these evil people exist and try to get
Totally.
into the system. That doesn't scare me so much as the systemic failure to call these people out and to recognize them when they actually do get into the system.
Yeah, you're totally right. We should feel. I remember there's this famous psychological case with the talking about the diffusion of responsibility. How one was being raped in the middle of an apartment complex, and there were dozens of onlookers, and nobody wanted to do anything because everybody felt like the responsibility was diffused across all the observers. And I remember asking my professor at that time, like, "Well, what can you do about that?" And he said, the only thing you can do is recognize the fact that these biases exist and then try to work against them. And so basically, knowledge of your inherent biases, knowledge about your psychological faults is the only way to overcome them. And I thought that was really profound. And so when you see things that are scary, you should know that the impulse is to do nothing, to know that others are equally going to do nothing, and to fight that. Right. So, yeah, really good
Yeah.
point.
Stand up. Okay, the last few stereotypes we have are ones that apply to both doctors and nurses. And so maybe
Yeah.
this will resonate more with the public. So, number one, huge stereotype, and it's that there's a high level among doctors and nurses of cheating or infidelity in relationships.
Um, oh, man, you go first.
I mean, okay, I've got to say, after going through divorce, I dated a couple of doctors, and both were cheaters.
Yeah.
One's like marriage fell apart because he had an affair with a nurse, and then the other one was just, not being honest about status of a relationship, and had been sort of caught cheating in the past. And anyway, so that's a very small sample size. But I've also seen it in hospital units where I've worked at, where I've seen a few doctors over the years blow up their marriages, having affairs with nurses. And then I've seen culture in between nurses of like nurses dating each other, and then sort of it being this incestuous dating pool, and people like cheating on each other within this dating pool. So I don't know. It does seem like, oh, maybe there's something to it.
Yeah, I'm inclined to agree. I remember that there were like these studies that were done looking at what is the level of adultery in society. And this really big study showed that 17% of people, their father is not the person that they think it is. And
Wow.
that was replicated everywhere across the West. And it did not matter the how rural or how big city, small city, farming community, or whatever. It was down to like the 17% across the board. Okay, I don't know. I don't know if that's exactly true or if that's false. I don't know what other sort of factors or things might play a role. I'm sure that there are like subcultures of like people who do strange and different things. But when you put a bunch of people, right? Psychologically speaking, if you wanted to get two rabbits to mate, the best way to do that is to put them in the back of a car and drive around, because rabbits hate driving around and they can't see anything and it's dark. And so they develop a bond between that. And so it's the same reason why stereotypically, if a guy wanted to take a girl on a date, he would take her to see a scary movie, because the mutual experience of going through something scary gave them a bond, gave them developed a relationship faster. And so I'm like, if you think about it, in
Damn,
general, not always,
sorry,
but
just to interject, I just realized I've never heard this before, and I'm like, damn it, I just realized how many times, like, when I was younger, going to scary movies on dates. Damn it.
yeah, I
Yeah.
would say that I would give that like a 6 out of 10. I would say that there's probably more truth
Yeah.
to that than not.
Yeah, it would be around the same. And especially with the idea of it happening in the hospital, like if you work in healthcare, you feel like you're radioactive as soon as you step into work and you're just like, ugh, you get
Yeah,
home and you
exactly.
like take a shower, wash your hair, you feel disgusting. So
Yeah,
it's not
totally.
happening in hospitals. Okay, so we agree on that one. The next one, we'll probably agree on this too. Dark sense of humor. I think this is a 10 out of 10. I do think
It's
that
a 10.
people, yeah,
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 it's a 10. It's unfortunate. I mean, like, people get in all kinds of trouble because, they overhear people, the nursing staff or the physician staff laughing about something that's particularly dismal.
yeah,
And, I always tell any patients who I've had in, probably one or two a year, who will pull me aside and say, hey, you know what? They were laughing about something, or, it felt really uncomfortable or whatever. And I always tell them the same thing. I'm like, I understand where you're at, right? Right now, how you're feeling, what's going on in your world, that this is really inappropriate. I just want to let you know that this is not a sincere capriciousness, right? We're
yeah.
not a bunch of psychopaths out there, is the way of dealing with it. And it's much easier to laugh than it is to cry, because you won't stay here if you keep crying. And so the
That's
dark
a
sense of humor is a
great,
protective mechanism.
that's a really great way of putting it to patients. And I'm glad to hear that you do that because I know this is something that sometimes you just shake your head because it happens a lot. Nurses, especially on night shifts, and they think, oh, all the patients are asleep. But then you've got patients wandering around, approaching the nursing station. They hear what you're saying, or even the ones whose rooms are nearby, and you're cracking your jokes, inappropriate jokes about whether, medical conditions or very tragic stories. People hear it and they freak out, and they don't understand it. And so it's
Yeah.
nice that you would say that because I know I've seen it happen, and it's not malicious people that are always doing it. And but if someone were to complain to the doctor the next day, I've seen a lot of doctors being like, "Oh, well, that's inappropriate, and let's do a
Yeah.
complaint," rather than
Yeah.
sort of your response, which is trying to understand where the person is coming from. But that said, the nurses should also like don't be stupid. Don't say those things where you can be overheard. Very poor
Yes.
form.
And to your point about being overheard, you should very much expect not only that people might overhear, but that they're trying to overhear. Nobody's sitting in their room waiting for like 4 hours for lab tests to come back, or radiology to have read something, or a plan to have been put in place, and they're not listening to the nurses outside, or they're not listening to the doctors talking to the nurses. I mean, like, what else can you do? Not
Yeah.
only is it interesting and relevant, well, it could be relevant, right? You're bored. You have no other option, right?
Yeah.
Like, it's working on your Sudoku puzzle or whatever book you're pretending to read, and then listening to the
Yeah.
gossip that's happening in the department. So
Spying
you
on the
should expect people to be
nurses.
listening. Yeah,
Hearing
yeah,
about all of
totally.
the affairs going on, the broom closets being used inappropriately. You gotta hear about all of it.
Yeah. So that's like a 10. Yeah. Okay. Last
Yeah.
one, also a really good one.
Yeah.
Nothing grosses us out. Is there anything that I mean, like, this is a tricky one because in my world, nothing grosses me out really, and then in
Yeah.
your world, like the mental health world, I don't know what it's like.
Well, I did a mix because, but like I mentioned, I did acute medicine in my preceptorships. I also did outreach nursing, which was they had a sort of a mental health team and a primary care team, and I was on the primary care side. So a lot of that was like chronic disease management,
Yeah.
and wound care was huge. It was probably like 75% wound care. And
Yeah.
the sort of things I saw, especially this was in the downtown east side of Vancouver, where you have homeless, drug addicts, just like the worst conditions possible that you would ever see in North America for living conditions for human beings. And so it would be like cleaning out maggot infested wounds, cleaning wounds for people. They've got like rats and bed bugs and cockroaches everywhere, and they just are not, they're injecting drugs into their venous leg ulcers and just like absolutely horrific. It smells really bad. And I actually was doing this when I was pregnant, and I remember feeling horrible one time because I started gagging about the smell of wounds in like early pregnancy, and I just could not help it. It was involuntary, and I felt so bad because I didn't want to shame these people. Are like so ashamed of what they're presenting with too. So generally I have a pretty strong stomach, but something that have a hard time seeing is bones breaking, especially in videos. And like my boyfriend loves to send me videos because he does jujitsu. It's like, here, look at this video of someone's leg breaking in half or their bone snapping.
Yeah, but I think wounds is the big one. You're right.
Thank you so much for tuning in this week, everyone. I hope you had fun. And if you think that we forgot to address a stereotype, let us know. And maybe we'll do that at the intro of one of our next episodes. And we will see you next week.
My friends, let us consider that acuity is the refined clarity of thought and perception which enables one to discern subtle truths.